a rather more significant issue here is that people who are dying of coronavirus. A report from the Public Health England yesterday, supposed to have been published last week and supposed to actually include some measures about what to do to tackle these issues, but it did report that ethnic minorities do face double the risk of dying from coronavirus as their white counterparts. Let's talk about this with Khalid Mahmood, who's Labour MP and Shadow Minister for Defence Procurement. Good morning to you, Khalid.
Good morning, Julia.
Good morning. You've seen this report. It's published, a little bit later than it was supposed to be republished. There was some concern it was going to raise issues, some race relations issues in the wake of what's been going on in the United States and the killing of George Floyd. I'm not quite sure why statements of fact would raise race issues, but what are your concerns after seeing the report?
Well, I don't think there's a reason to raise race issues. I think what the issues are is quite clear in terms of that it has been factual. Okay, so there's been a significantly more per capita death of black and ethnic minorities, which is quite clear. And there are issues in relation to health, long-term standing issues in terms of health of a majority of the BME community. And I think that has a significant contributor to the deaths in the COVID sense as well. So I think, yeah.
There seemed to be some accusations a few weeks ago when this emerged, and of course it was very stark when we saw those photographs of the first NHS workers and doctors to die, to discover that that so many of them were black or Asian, and there were question marks raised because we know there are some risk factors. Being old is the first risk factor. That's the key one if you're over 70. Being a man, having obesity doubles your risk having obesity. But we also know, as this report has found, that living in a deprived, being from a deprived background doubles your risk. But also some ethnic minorities face double the risk. At some point, some of the reports have said that some ethnic minorities face 4 times the risk. That's simply not the case. Bangladeshis, 102% increase. Back Caribbean, 10% increase. But the study made it very clear, and I did read the study. It did make it very clear that although it had accounted for where people lived and their income in their area and things like that, and whether they live in a city or a rural area, that's of course going to have an effect on whether you're more likely to come in contact with people. But it said it did not account for occupation. So people who work, for instance, as bus drivers or work in the health service are more likely to come into contact with the virus. And we know for a fact, certainly in London, which has been the epicenter for many months of the virus, a huge number, 45% of people working in the NHS are ethnic minority, and very large numbers of people working in public transport. Comorbidities, other health issues, and obesity, they weren't taken into account, and we know some ethnicities have twice the rate of obesity and of diabetes as other races. Does it make any sense to have a report into whether or not black and other ethnic minority people have a higher risk of being killed by this report if you're not going to take into effect some of the key facts related to why people are catching the virus? It may have nothing whatsoever to do with race. It may be entirely down to the jobs people do and whether they're fat or not. It could be that basic if we're looking at these big stark differences.
Well, I think it is a lot to do with the jobs they do, and I think that's quite clear. If you work in a care home, if you're a taxi driver, if you're a porter, if you work at the front-facing end of the National Health Service, you receive the patient in nursing or care, you are going to be far more at risk in relation to that. But also, as you said, if you've got underlying health conditions, if you're living in a 3-generational overcrowded property, that's going to have a problem as well. So I think those things. And I think the report basically is really a damp squib. It's got no real understanding of what the issues behind it are and how we address them. That was what we wanted to see, is how can we address some of those issues and move forward.
Well, how do we address them if the issues are no different to the issues facing everybody who lives in a more deprived community and who is overweight and more likely to have made poorer health decisions over the years? Again, much easier to do so if you're living in a nice middle-class home and got money and blah, blah, blah. We understand that. But there's lots of talk of health inequalities. Largely these come down to different lifestyles chosen to be lived by people. Unless we actually get into people's homes, control what is in their fridge, what they put into their mouths, we're not going to have health equality.
Well, I think we will have health equality if we have a look at the way that those communities are not overcrowded, if the way that we provide proper housing that should be available. Over the last almost 40 years, we've done nothing in terms of houses. I've got sort of back-to-back terraces two and a half bedroom, which got somewhere 6 or 7 people living in this, and usually 3 generational people living in that. You do have issues in terms of health, where over the last 10 years, a lot of the support that was given in the community in terms of diabetes, high blood pressure, and all those sort of things have now been shut down because a lot of the community funding for community health and those sort of things have gone down. So those things we can work with, and those things we can try and deal with.
I mean, a lot of people might be shouting at the radio right now, saying, Kelly, people saying, well, people living in overcrowded housing. Look, we have a duty to provide decent housing for everyone in this country. However, if someone chooses to have more than, say, the average of 2 children, then their homes are going to be more overcrowded, are they not? Many people choose not to have more children. We know that some ethnic minority groups have much larger family groups, and they're free to do that. But I'm not quite sure why the rest of the country is responsible for people living in overcrowded housing if people are choosing to have more children.
I don't think it's the number of children in that sense. I think if you've got a family of 2, say 2 or 3 children living and who haven't spanned out because of the job condition to be able to buy another house themselves, so that generation will live together, and that's what the problem is. It's about the income to be able to afford new housing and to be able to move out of those areas. And some of the inner cities, whether you're black or white to a large extent, that's what happens, and that's part of the issue. And if you've got then underlying conditions because of who you are essentially, and you're more prone to diabetes, the food, no matter what sort of food you have. If you're diabetic, and if you come from say a BME community background, whether you come from India, Asia, or the Caribbean, because of the different way you take in vitamin D and those sort of things, that has a knock-on effect. Okay. If you've got single-cell thalassemia, that's something that's very difficult to avoid, and so those sort of things have a real issue in order to do that.